So in this video we are going to talk about hypothermia in a newborn baby, starting with how we define a hypothermia. So normally the body temperature is between 36.5 degrees Celsius to 37.5 degrees Celsius. A temperature of less than 36.5 degrees Celsius is what is hypothermia. Now we have three stages. Either if the temperature is between 36 to 36.4, the condition is cold stress. Now this is not given the name of mild, so there is no mild hypothermia in the cases of neonates as we studied the hypothermia in adults. A moderate hypothermia is between 32 to 35.9 degrees Celsius. The point to be noted here is that the child will have cold extremity but the abdomen still will be warm. When the temperature goes below 32 degrees Celsius, this is what is severe hypothermia, and the child will have cold extremity as well as cold abdomen. This is how we clinically check for moderate or severe hypothermia. Let's try to understand why preterm baby are one who are more prone for hypothermia rather than a term baby, but still a term baby can also suffer from hypothermia if not covered adequately or not managed. So what are the method of heat distribution around the body? So consider this a table in which child is lying. So either the heat dissipation can be through conduction, that is material transfer by contact between two things, that is body of the baby and the table. There can be evaporation. This evaporation can occur because the baby is still wet and the water or the fluid keeps on, amniotic fluid keeps on evaporating, and along with evaporation takes up the heat. There can be radiation, that is heat dissipation into the surrounding. This is maximum via the head due to the large surface area that is exposed. We have convection, that is the air flowing around, along with it take the heat from the body. So we talked about the four methods of heat dissipation. These are the conduction due to material contact, we have the evaporation due to fluid, we have radiation around, and convection because of the air currents. Now why the baby is more prone for hypothermia? This is because they have a more permeable skin with a low quantity of subcutaneous fat, and there is increased body surface area in accordance to their weight. Okay, and there are limited mechanisms for heat gain when the baby is born. Okay, and the outside environment is new to him. Till now he was living in utero and the environment was completely different. Now he has to adapt for increasing the temperature to different surroundings, so it is completely a different case. Talking about what happens when a preterm baby, okay, so here we are talking more about the preterm baby because he is the one who is more prone for hypothermia development. So what happens when a baby is exposed to cold environment? At first note itself, we need to remember that babies do not have shivering mechanism for generation of heat. They cannot shiver at start, so this mechanism is not going to work. Okay, the baby starts to cry when there is cold stress, that is a temperature of 36 to 36.4 degrees Celsius. Also the sympathetic activity starts to increase within the body. This leads to release of norepinephrine. Now there is a large sympathetic innervation within our brown adipose tissue. This is how we have shown the brown adipose tissue. Okay, so brown adipose tissue has small fat locules, larger in number compared to a normal adipose tissue which has a single fat locule, and there are multiple numbers of these red dots. These are the mitochondria. So brown adipose tissue is sympathetically innervated, large number of locules which are smaller in size, and it has high number of mitochondria. When stimulated by norepinephrine, the brown adipose tissue uncouples the beta oxidation. So normally the fatty acid was undergoing beta oxidation and generating ATP. But this norepinephrine acting on the beta brown adipose tissue uncouples the process of beta oxidation, and now we have increased free fatty acid. This by different mechanisms, we don't need to learn about them, increases the temperature. This is what is known as non-shivering thermogenesis, because a baby is not undergoing shivering but still the thermogenesis is occurring, that is temperature for maintaining the temperature. Okay, the brown adipose tissue help by uncoupling beta oxidation. This is non-shivering thermogenesis. Also, because of increased level of free fatty acid, this increased free fatty acid uncouples the bilirubin from albumin, leading to hyperbilirubinemia. The sympathetic innervation will act on pulmonary arteries and will lead to pulmonary vasoconstriction. This will lead to pulmonary hypertension. At same point of time, increased metabolic activity is decreasing the oxygen level in our body. These two together, the decreased oxygen level and pulmonary hypertension, are going to lead to hypoxemia. Okay, decreased level of oxygen in our blood. Also at same time, because of decreased oxygen in our blood, the body starts to activate other mechanism for generation of energy. These include anaerobic metabolism. Because of anaerobic metabolism, the lactic acid level starts to rise. This leads to metabolic acidosis. Okay, also because of increased metabolic rate, we have decreased level of glucose in our body because of increased consumption of it, so the baby has hypoglycemia. Okay, also when the temperature falls below 32 degrees Celsius, the hemoglobin cannot dissociate oxygen from it. This also flares up the hypoxemia. So in total, we studied that in a cold environment there is increased sympathetic activity, increased temperature occurs because of non-shivering thermogenesis, because shivering cannot occur. We also have hyperbilirubinemia, pulmonary hypertension and decreased auto lead to hypoxemia, anaerobic oxidation occurs, lead to metabolic acidosis, and we have hypoglycemia. We already discussed about the stages of hypothermia. Okay, talking about the measurements we need to take in the case of hypothermia. So if it is a baby, a normal healthy baby, we need to measure the temperature once daily. If it is a small baby who is healthy, means the weight is less than 2.5 kg, we need to measure the weight 3 times daily. If the weight is less than 2 kg, 4 times daily. If it is a sick baby, every 2 hours we need to note the temperature. So how do we prevent hypothermia in a baby? The first thing first, the temperature should be 25 degrees Celsius in the surrounding. There should be no drafting air passing around that will lead to convection. Okay, we need to avoid it. The child should be wrapped in a dry linen cover. Note that the head of the baby should be covered with head cap, which is most of the time ignored and is a cause for hypothermia. No use of wet towel should be made. Kangaroo mother care, already discussed in one video properly, is a method of preventing hypothermia in a stable baby. Okay, breastfeeding also promotes thermogenesis. Rooming in, okay, postponement of bathing and weight measurement should be done in a baby who has hypothermia. Okay, only bath sponging can help later when the hypothermia is being corrected. Training and awareness should be done of the family that will help in preventing hypothermia. If the baby is unstable, we can either use the incubator. So incubator, you must have seen, these are the closed spaces where the airflow maintains the warm temperature around. Anything that is to be given is given through these two holes that are present in the incubator. There is another method of temperature maintenance that you may have seen in the OTs, that are the radiant warmers. These radiant warmers, through the radiant heat, help in maintaining the temperature of the baby. Okay, so this is in short we needed to know about hypothermia in newborn. Thanks for watching.